Hi, my name is Joanne Jarvie. I am the Director of Outreach and Advancement for MyHIN, and I'm going to be with you all day. I'm going to be your MC. I got to come up with some really good stuff here. But I am thrilled to introduce our first speaker today. Elizabeth Hertel is the Director of Michigan Department of Health and Human Services. Previously, she was Senior Chief Deputy Director for the administration, where she oversaw external relations and communications, financial operations, legislative services, legal affairs, policy and planning, strategic integration, organizational services, workforce engagement and community, and faith engagement. So, no big deal. Hertel joined the Michigan Department of Community Health, MDCH, in 2013 as the Senior Assistant for Policy and Planning, and in February 2014 was appointed the Director of Policy and Planning. Following the merger of the Departments of Community Health and Human Services into MDHHS in 2015, Hertel served as the Senior Deputy Director for Policy, Planning, and Legislative Services. In October 2016, she left that position to serve as Director of Michigan Advocacy for Trinity Health and returned to MDHHS as Chief Deputy of Administration in February 2019. We feel so lucky to have Elizabeth with us today. Thanks.
Hello, everybody. Thank you so much for inviting me to join you today. It is a pleasure to be with you as you meet to discuss the many factors that contribute to our healthcare delivery, opportunities to work collaboratively to ensure access to quality care. This past year has been a difficult one for people across our state and in our healthcare community. Well, COVID-19 amplified challenges in the availability of data sharing, and interoperability of systems, social determinants of health, equity and access to care, delivery of coordinated programs and services. These are not new challenges or barriers. They have existed for decades, or in some cases, much longer. However, we have the chance, having seen how a lack of investment in health infrastructure, including our information systems, systemic inequity, and other barriers impact our friends, families, neighbors, and so many. To make changes now that could decrease fragmentation in how we deliver health-related programs and services now and for years to come. Making progress around our contracts and our information systems infrastructure internally across the health and human services spectrum will take investment and strong partnerships, but it is one of my priorities. As a country and as a state, we've talked a lot about infrastructure the past few weeks, and we will again this week. But after we talk about roads, bridges, and drinking water infrastructure, we also need to turn to the health and health information infrastructure. One of the things that this pandemic taught us is the power of finding new opportunities to collaborate, having systems that interface so that we can cross-reference and what happens when we don't, and holding each other accountable as we interact with the people that we mutually serve. Monitoring bed capacity to understand where the healthcare system was strained or eased as we experienced surges in COVID-19. Working across a network of COVID-19 testing sites and sharing lab results quickly, even as testing volumes rose dramatically. And telehealth, which is something I hope we will continue as an option long after the pandemic, particularly for rural and urban communities where we know transportation can be a barrier. For MDHHS, continued short and long-term solutions or progress might look like our department and managed care setting mutual goals, or that might look like strengthened relationships between providers and payers, or all of the above. We have made some progress in electronic health information and sharing, and I would like to thank MyHIN and all of our other stakeholders participating today for your collaboration with that. However, despite the progress that we've made, we know that we have more work to do. Many of our health and human services systems that we use to capture, keep, and pull data or process applications and benefits, or to maintain cases, systems that may have information about health, but also about other factors that influence health, are very old, and they often don't have interoperability with other systems, internally or externally. There has not been the type of investment that we need, and now our systems are technologically behind. This means that we're missing opportunities to collaborate with each other and to apply data to the decisions that we make, or ways that we continue to tailor our work to the people with the greatest needs. I know all of you are looking at health data. However, on the human services side, we're working where we can to update, including our MySACWA system, which is used by our Children's Services Administration to manage our caseloads. And we're working with our incredible partners in local health and hospitals to look at equity and gaps in COVID-19 and vaccination rates. However, the proper investment would allow all of us to work smarter. Addressing social determinants of health and equity are priorities at MDHHS that could benefit from more interconnected systems, sharing, and partnerships. Access to care and treatment is important, but so is making sure that individuals and families in urban and rural communities have safe housing, clean water, access to healthy food, and so much more. Our healthcare workers have shown heroism during this pandemic. They work hard and they make sacrifices to care for us, but there are still inequities, deep inequities that exist in healthcare. It is important that we address these social determinants of health and the root causes of inequity in meaningful ways. In addition to CMS's pledge of a $9 million Medicaid match to launch the new Health Equity Project with this organization and others in 5 counties, MDHHS is looking at gaps both internally and in the way that we provide services, programs, outreach to communities, and how we award those grants. The budget recently signed by Governor Whitmer builds on kitchen table fundamental issues that matter most to Michiganders, and there is a role to play for organizations and efforts aimed at building those connections in these 2 areas. The latest budget provides an opportunity for us to expand the work of our Race, Equity, Diversity, and Inclusion Office. The budget also covers the cost of healthcare navigators to tackle racial health disparities and to increase coverage. And it will allow us to grow the Healthy Moms, Healthy Babies in-home visitation programs for infants born with substance use disorder. One positive development of the pandemic is that it made us adapt, and in some cases, find better ways, or ways that we can be flexible at the state level and local level in our delivery of services. We took information and cross-promoted services and programs where there might be an overlap in terms of need. And we know telehealth was more broadly offered for people throughout the entire state. Programs for moms, babies, and families are also perfect examples of this. This past year, we worked with local stakeholders to work with healthcare providers to address the limitations of a shift to primarily remote appointments, still be able to capture important referral data and complete nutrition and health assessments. We were able to set up a warm line last April 2020, that more than a year later is still providing moms with support 7 days a week. We were able to strengthen partnerships like the one with the Southeast Michigan Lactation Consultants of Color to provide hands-on, in-person breastfeeding support. And we worked with local agencies to create virtual mom groups, moving those classes online and setting up curbside pickup options for breastfeeding supplies. More integrated systems could also help us better coordinate across the physical and behavioral health care continuum. Every Michigander deserves access to safe, affordable, and accessible healthcare in their community, whether their needs address physical or behavioral health. The budget invests in new, innovative mental health services to help those who need it most. We are working on a project to improve the coordination of behavioral health services for children, but also exploring paths to better integrate physical health and behavioral health for people of all ages. We're also expanding the CCBHC, Certified Community Behavioral Health Center, demonstration with the hope that this model could eventually work across the state. Last year, more than 300,000 Michiganders were served through our public behavioral health system. However, there are still many people, our friends, our family, our coworkers and neighbors, with a behavioral health diagnosis or substance use disorder who do not receive treatment. And even if they do, their care coordination remains very fragmented. We have incredible partners in healthcare who work tirelessly to treat patients, but we can improve upon any system. Those CCBHCs provide a service array to facilitate access, stabilize crisis, address complex mental or behavioral health diagnoses and substance use disorders, and emphasize the physical behavioral health integration. Through this demonstration and other work done by the department, we've been shown important opportunities in healthcare and the factors that contribute to a person's health over their lifetime. A 40.7% decrease in homelessness, a 60.3% less time in correctional facilities, and 63.2% fewer emergency department visits for behavioral health reasons. So needless to say, I'm very excited about this expansion, the patients that we know it will serve, the additional lessons that we can learn, and information that we can apply to other communities, and the chance to identify further improvements that will improve access, improve care, and continue to be life-saving. Seamless coordination of care requires the ability to better share information, as you all know. And I'm very excited about our work ahead. It will take all of us moving in the same direction, and I am optimistic that we can take significant steps in the short term that will lead to longer momentum and meaningful, lasting changes. So again, thank you for your dedication and for your enthusiasm for this work and the hard work that you've put in over the last 20 months. I hope that you will stay in touch with me and our department, and I look forward to working with all of you. And with that, I'm happy to take questions. And they are going to put questions in a chat here for me. And I think they need to be copied and pasted from one place to another. So it may take just a moment. Nothing yet. I find that very surprising. So many questions, especially when it comes to our information technology at the department.
Hey, they're going to let me actually ask a question.
Oh, that wasn't part of the deal.
I know. I'm sorry.
Hey, Tim, how are you doing?
I'm doing great. Hey, thank you. Fantastic. That's an outstanding list of accomplishments. Very, very impressive. One of the questions that I wanted to just ask is, there's a lot happening around modernization, and I think you alluded to it a little bit. But what are some of the things that you think will really happen as we modernize some of the technology? What kinds of changes do you expect that will become more feasible as we get our arms around this data monster that we're all struggling with?
Our goal as we continue to modernize and upgrade systems, and two right now off the top of my head that I can think of that are pretty major, is the MySACWIS replacement, which is our children's services model, and then our disease surveillance system, which is exceedingly outdated. The ability for those systems to allow us to pull data and compare or bump data up against other systems internal to our department will be incredibly important. Because right now, is, we have to do data pulls and then manually compare or input data into other systems. And that is exceedingly time consuming and of course open to error, because this is human error, and that's to be expected in some cases. So that is our priority moving forward as we continue to modernize some of those systems. And even for those systems that we don't have the ability to modernize yet, looking at how we can do that data pull, that data extraction, and work to analyze that data internally. And long term for me is the idea of how we're able to then share that data extraction and analysis externally with our stakeholder partners, because they also have a lot of information that can be helpful for us to serve people in our communities.
Awesome. There is a question from the outside world. I'll paraphrase it if you want, so you don't have to try and read the chat. Do you have, and this is from Diana Bunch, I can't say it properly, so I apologize. Do you have specific priorities for HIE that the department will be focused on?
I don't have any specific priorities for HIE at this point, aside from how we can continue to partner with the exchange to help us move that data that we are extracting and others are extracting to put in a common place to do the analysis.
Awesome. And then there are two questions. Is there a plan to collect SDOH data, that's short for social determinants of health data, in the MDHHS Encounter Data Warehouse?
At this point, we don't have plans to collect that data. And the social determinants of health data is an interesting question. And what I think we need to do as a state, with all of the stakeholders who work in this field, is to understand who is already gathering social determinants of health data, because I do believe that it is happening across the state in other locations where people are going. So how can we take advantage of the data that they're already collecting, and then again be able to bring that together and bump that up against the information that we have? So I don't want to do things that are duplicative of things that are already happening in the field. I'd really love to be able to just figure out how to leverage those activities for the benefit of all of us.
Well, one of the things that I think is of value in that particular space is everybody's collecting those social determinants of data differently, very well intentioned. And there's a national standards group under HL7 that's really working on trying to standardize that, called the Gravity Project. And so I think there's a lot of opportunity for us to, like I said, not have that duplication, but try to figure out how to put that data together in a standard way. I think that's very exciting.
Yeah, that is exciting.
The other question that's come in is, for those of you who don't know, can you talk briefly about how MDHHS works with MICR to share vaccine information?
That's a pretty broad question that I'm not sure. I'm not necessarily sure what it means, but I'll do my best to give an overview. MICR is our Michigan Care Improvement Registry. It collects vaccine information on all vaccines administered in the state, and we have a great central database for that. That vaccine information can then be requested from providers or local health departments. Anybody who has children in school or daycare knows, in the late summer, you call your doctor's office and say, I need my immunizations, so that you can submit those to the schools. What we've been able to do over the last couple of months, which is really exciting, is create a public portal so that people can actually go in and pull their own vaccine schedules directly from the database. So that's very exciting. Still only available right now for adults 18 and up, but we certainly are looking to expand that to allow parents to be able to access their children's vaccine information as well.
The next question I'm going to try and paraphrase, but basically it's around the question of, is there any consideration for allowing the internet to be a Medicaid allowed expense? But I want to expand that question and just sort of talk about the sort of classic digital divide and really getting I'll call it broadband infrastructure more pervasively available to sort of those areas in Michigan where it's not as accessible. I've heard there are a number of federal initiatives. Is there anything afoot that people should know about?
I don't have specifics on anything afoot, but I will say this from the Department of Health and Human Services perspective. I believe that access to information is an integral social determinant of health. And the ability to access that information through broadband access is incredibly important. So while MDHHS isn't the primary department in the state of Michigan working on that digital divide, we have provided input on the elements that we see as important for ensuring that people have broadband access across the state.
I think that's as important as transportation in the modern era. And it's referenced here in the questions about sort of the use of telehealth really requires, you know, some of that level of infrastructure and access. I'm not seeing any other questions coming in. Do you have any final closing remarks other than we just want to say thank you? We're really excited about where things are going.
I would again like to say thank you. I kind of got the impression I was late, but this was on my calendar for 9:10. So if I was late, I apologize. I just do what my calendar tells me at the time it tells me to. So
you were perfectly timed and
okay.
Perfectly timed. So.
I just want to reiterate for everybody, and you'll either find this very exciting or very concerning, that information technology is an important priority for me, and bringing our state systems into the modern era is a priority for me as director of this department, because I know the power that all of that data holds, and it would completely transform the way that we are able to serve our communities if we could really leverage that data and the data sharing. And this will continue to be at the top of my priority list. And I will continue to challenge ourselves internally and our partners to make strides in this area, because I believe that in the long term, this investment is so important for the outcomes that we can see for people across the state. So I think we're entering into a really fun time, hopefully, to work together and really do some cool things. And I really appreciate the time here to speak to all of you.
Director Hertel, thank you very much. We're very excited about this sort of commitment to interoperability and really making data available. Thanks so much for joining us. I'll turn things back over to Joanne.
Thank you, everybody.
Thank you so much. That was incredible. I'm so excited that I got to see it. I'm so excited that you're here. Thank you, Elizabeth. I wanted to give you guys just a quick rundown of what we have to come. So at 10 o'clock, we're going to go to talk about those social determinants of health. You know, social determinants of health make up to about 80% of a person's health and wellness. And it's a new world here when we talk about what makes people healthy and what makes people well, beyond just their access and to medical care. So that social determinants of health panel is going to be moderated by our new social determinants of health program director. They're going to talk about the state of data interoperability and those national standards, HL7 and Gravity. Regional developments, what's happening in Michigan, and how MyHIN is trying with our use cases to have what Director Hertel called those small sort of short-term wins in long-term change and transformation. And then we're going to talk about the constraints that the healthcare data sharing and payment methodologies impose. We are working under HIPAA. HIPAA applies to health information. Our social determinants of health, always health information. These are questions that our country is grappling with, and MyHIN is right at sort of in the places where we need to be to figure out all these ethical and legal questions. After the SDOH panel, we are going to have a break we're going to come back and we are going to go back to that BCBSM EHR vendor initiative. And our own Bo Bernacki, who has been here for a while, is going to be moderating that. And we will have time for networking. We will have time for lunch. We will have our Chief Policy and Privacy Officer, Shreya, talking around 12:30 about beyond the right of access. Following that, we will have the Interoperability Institute, Vice President Mary Krantz, followed by a panel of POs, which is going to be totally awesome, moderated by our Eva Matuski. And we have three POs on the panel, and she's coming at it hard-hitting questions about how MyHIN works with POs and the roles of providers. Then we're going to have a Senior Deputy Director of Policy, Planning, and Operational Support Administration with MDHHS, Beth Nagel. So we're going from the state, and then we're moving through this new world of social determinants of health, this health transformation. Then we're going back to the health plans. Then we're moving into the providers. Then we're going through privacy and through consent and consumer choice. And then we go back to back to the state, back to MDHHS. And we're working through the technology at the Interoperability Institute. And I think, what I really would love for you to take away from today is this place that MyHIN is so lucky, I think, to be in, this central place between all of these sectors looking to communicate, all of these sectors looking to data to make them work better, to make us communicate better, to learn more. It's just a really special place to be. And it's a beautiful, as Tim said, a beautiful public-private opportunity to keep things moving and keep things working in a legal and trusted and useful way. So our next panel is at 10. We'll see you here back there very soon.